The Flint water crisis is a well-known ethical and moral dilemma that occurred in the city of Flint, Michigan. In 2011, Michigan's Governor Rick Snyder appointed an emergency manager to supervise the city of Flint, as it was under severe financial distress. The emergency manager, Darnell Early, was appointed and made many cost-cutting decisions. In April 2014, Early made the wrongful decision and changed the city of Flint, Michigan's municipal water supply source under state-appointed emergency, from the Detroit-supplied Lake Huron water to the Flint River as a cost-saving measure. This switch was intended to be temporary, until a new pipeline could be established in replacement of the old pipeline. The decision to switch water sources was made without conducting proper testing and treatment of the new water source. Because there were no proper tests conducted, one of the critical errors in the crisis was the failure to implement proper corrosion measures when switching to the Flint River as a water source. As a result, the river water extracted lead and other pollutants from the aging pipes and infrastructure into the city's drinking water. Soon after the switch, Flint residents complained about the horrible tasting and dark-colored water. Many independent tests found that a significant proportion of samples had levels above the action level for lead set by the United States Environmental Protection Agency. Even after days, months, and years of attempting to get officials of all levels' attention, nothing was being done to address the ongoing water contamination problem. The government officials chose to ignore the complaints and worries made by those that resided in Flint. The government officials acknowledged the problem only after residents made a public and national uproar about the unsafe and undrinkable water. The core ethical dilemma was the fact that the government officials and emergency managers made their decision based on financial concerns rather than the public's health and safety. They also chose to ignore the public outcry for help despite the health concerns and discomfort their irresponsible and inconsiderate decision of switching the water source caused. Even though there was a considerable amount of evidence of lead contamination and health issues, it took several months for the government to acknowledge the severity of the crisis and take meaningful action. The lead-contaminated water had severe health implications, particularly for children. Lead exposure can cause irreversible developmental and neurological damage. The city's residents, especially vulnerable populations, were exposed to these risks. The crisis disproportionately affected low-income and predominantly African American communities, raising concerns of environmental injustice. The question of whether such a crisis would have been allowed to persist in more affluent communities also created ethical dilemmas. Moreover, there was a considerable amount of concern around the transparency and accountability of the government officials at the local, state, and federal levels. The residents of Flint, Michigan were not appropriately informed about the risks and true nature of the water crisis. In 2015, the water test results showed that there were still elevated lead levels in Flint's water. The residents of Flint, Michigan joined with the National Resource Defense Council to petition the United States Environmental Protection Agency to begin an emergency federal response to the crisis. The Environmental Protection Agency failed to act on the residents' request, which only infuriated them even more. Additionally, government officials and emergency managers continued to downplay the harm and health issues that their decision caused. They failed to address and own up to their mistakes, which is unethical. Many questions arose about who should be held responsible for the harm and destruction that the decision to switch the water source caused. In 2016, the city and state officials were sued by residents and other groups in order to secure safe drinking water for Flint residents, to replace all city pipes, and to complete proper testing and treatment on the water for lead. In March 2016, the coalition took additional action by filing a motion to ensure that all residents would have access to safe drinking water through a bottled water delivery service or have access to a filter installation maintenance program. In March 2017, the settlement required the city to replace the city's thousands of lead pipes with funding from the state, guaranteeing further funding to help residents deal with the residual effects of Flint's polluted water. As of 2021, 9 defendants were charged, all ranging from misdemeanors to manslaughter. In the context of the Flint water crisis under the social contract theorists Thomas Hobbes and John Locke would look over the contract between the citizens and the government. They would argue that the government has a contractual responsibility to provide essential services, including clean and safe water, to the residents of Flint, Michigan. The crisis would be seen as a breach of this social contract. Social contract theorists would also question the legitimacy of the government's authority because the government failed to fulfill its obligation to provide promised resources to its residents. The Flint water crisis might lead to discussions about the need for government reform or accountability mechanisms to ensure that the government fulfills its obligation to citizens. Utilitarianism theory focuses on maximizing overall happiness or utility. Utilitarians would weigh the costs and benefits of the actions taken or actions not taken by the government officials. They might argue that the cost-cutting decisions that led to the polluted and lead-contaminated water source were unethical because the decisions resulted in harm. The utilitarian perspective would try to maximize the overall utility of the residents. In this case, it would involve trying to minimize harm and suffering for the people of Flint by addressing the water crisis as quickly and efficiently as possible. This theory would have also taken the people's complaints and cries more seriously to ensure peace and happiness for all of Flint, Michigan's residents. This might include allocating resources for clean water, healthcare, and long-term solutions. I believe that it was morally and ethically wrong for no one to own up to the decisions that caused the Flint residents to suffer for a considerable amount of time. Although the people that made the decisions may not have known their outcome, their actions are still ethically and morally wrong. It is baffling to me that the government officials and emergency managers put people's lives in danger because the city was under financial distress. The Flint water crisis is an example of how unethical decisions and the failure to take accountability can have severe and everlasting impacts on a community and a country.